It's time now for the award-winning #1 local talk show in Northeast Pennsylvania, The Sam Lesante Show. Now here's your host, Sam Lesante.
Hi folks, I'm Sam Lesante. Do you know that over 23 million of us suffer from dry eye? 20 years and older, over 23 million of us suffer from dry eye. Well, first of all, what is dry eye? Not only that, how about this? 38% of the patients, visiting their eye care professional suffer from dry eye as well. So well, what is dry eye? What does it mean? And how does it affect us? Today, folks, we're going to learn about that, and my guest is no stranger to us here at SSP TV, Dr. Thomas Kislan from Hazleton Eye Specialist and Strasbourg Eye Specialist. Now, we're going to put the phone numbers on the screen because you may want to call and get information about this. Something exciting is happening in the dry eye area, and there it is. The Hazleton office is 453-2020. And the Strasbourg office is 421-3342, or go to drkislan.com. Dr. Kislan, how are you?
Great, Sam. Great.
First of all, thanks for coming on the show. I think what we're going to talk about today, I know this iFlow system, this innovative system that you have, which we'll get to, is really innovative, and it's going to be able to help a lot of people. But, you know, Doctor, you have your show, I Care Today, which people know who you are and you give information. This is a little different, the Sam Lesante Show, to try to explain, educate people to a whole new area. Dr. Thomas Kislan, give me your background, Thomas.
Well, I was born and raised in Pennsylvania, in Hazleton right here, you know, our practice is devoted to specialty eye care, and not just routine care, but where we really dive into certain diseases that affect the eye, and dry eye disease is one of them. And we're one of the only clinics in Pennsylvania that actually has a dedicated dry eye disease center, where we're dedicated to clinical research. We're consistently doing research. I travel all over the country, all over the world, presenting this research to other doctors. And a lot of times, what we find in our research changes the way other doctors treat their patients. So we're very proud of that. We've been practicing. I've been practicing over 16 years now. So I'm getting old and gray, but with that comes, I think, a valuable knowledge base of certain conditions, and dry eye disease is one of them.
You know, you said something about, you know, going around doing lectures and seminars as to what you are, you know, you bring out to other doctors. You don't have to be from the big city, you know, like you from New York City or Philadelphia or Chicago. People think, well, they're coming in, you know, these doctors really know. Here we are in our own backyard, so to speak. We have people like you who bring a tremendous amount of knowledge and actually teaching people about dry eye. Tom, what is dry eye?
Well, dry eye is a disease where the eyes don't produce tears either in the proper amount or the proper quality. And there's different forms of dry eye. And this is one thing that patients a lot of times don't understand, or their previous doctors don't really explain to them well. There's a condition called aqueous deficient dry eye where we don't produce actually enough tears themselves. And these are patients who have conditions like rheumatoid arthritis, any autoimmune condition, lupus, things like that. These patients just don't produce enough tears. But the bulk of dry eye is now what we call lipid deficient dry eye. And it's a lot of patients. I would say in practice, over almost half of the patients I see every day have some sort of realm of this condition, stemming from mild to moderate to severe. And we're going to look at some pictures and some videos of the glands in our lids, but there's certain glands in our eyelids, they're called meibomian glands, that secrete oils. And those oils are very, very important in preserving our tear film. And if we don't have good oils, we don't have a good tear film, and then all the symptoms of dry eye kind of flow, which is itchy, red, burny, scratchy eyes, blurry vision, painful eyes, and actually teary eyes. One of the symptoms can be the eyes water a lot. And a lot of patients say, well, how the heck can I have dry eye if my eyes water? And think of if someone pokes you in the eye, if one of your grandkids pokes you in the eye, what happens? Your eye waters. That's a reflex. So when something's wrong, the brain tries to fix it by flooding the eye with tears. So one of the main symptoms, and what our viewers should know, is if you have watery eyes, go see your eye doctor because you probably have dry eye disease.
Okay, so now you mentioned a couple of things about the glands, and this is not only for seniors. I mean, we have people who are in their 20s who have this, correct?
When a senior suffers from this, it's probably in one of the more advanced stages already. And I can say, and this is, you know, not to knock any of my colleagues or peers, but this is one of the most underdiagnosed, misdiagnosed, mismanaged, and mistreated conditions out there. Millions of patients suffer from this when they really don't need to with the technology that we have today. And it starts in our 20s. It can start with contact lens wearers. It's more prevalent in females, and it's very prevalent in the white Irish kind of fair-complected patient base, which we only have a couple of in Hazleton, but that's where it's very prevalent.
Okay, so you're saying a lot of people that may be suffering with this, they don't even know they have
No
it.
idea. Or they suffer with so long and think there's nothing I can do, so I'm just going to blow it off. But it can lead to some serious issues down the road.
Okay, what could it lead to?
Loss of vision. Actually, you can get scarring of the front part of the eye called the cornea, so patients will have trouble driving. They think, I just have cataracts. So they finally decide to come in and see us, and it's not cataracts, they actually have dry eye. It could be painful eyes, red eyes. We're staring at a computer more now than ever we did before. This condition makes computer use almost unbearable. Patients, their vision fluctuates, their eyes water, they're trying to increase the font on the computer because they can't see. So it can really lead to some issues down the road. It affects quality of life.
All right, so I don't know whether I have dry eye, but I do know I come to you every 4 months for examination, okay? Basically, you should really go, once every 6 months or 2 years to an eye doctor?
Depending on the age, between about 20 and 40, 45 years old, we say every 2 years. After 45, 50 years old, it really should be about every year.
Okay, so coming to you, when you're giving my eye exam and what you're doing, okay, could you tell whether I have dry eye?
Yes, the number one thing we look at is your symptoms, your history. Certain medications we take cause dry eye. Patients who take antidepressants, medicines for allergies, beta blockers for hypertension. A lot of these medicines we take cause dry eye. So we look at that. What time of the year is it? Usually patients in the winter suffer more because they got the heat on. The blowing heat makes dry eye worse. So we look at all that, and then finally I come into the room and I examine the patient, look at their eyelids, look at the glands, which we're going to show pictures of, and I can tell then. And then there's other battery of tests we do if I think there's a problem.
Okay, so it is something that you really should pay attention to.
Yes.
Okay. Yes. Folks, I'm talking to Dr. Kislan, and you can contact him at his 2 offices, the Hazleton Eye Specialist Office, which is on the screen, 453-2020, as well as Strasbourg, which is the 421-3342, or go to his website, drkislan.com. We come back, we're going to show a video, and he'll show you exactly what you're looking at. And there is something that is amazing right now that he has, one of the few in the country that he has that can help you out. Stay with us, and we'll be back right after this. Welcome back to the Sam Lesante Show, folks. 24/7 SSPTV.com. All of our shows are there, as well as my email, sam@ssptv.com. One of the sponsors of our show, folks, is a new product that's out. You've seen it. It's called the Power Frame. What is this? Well, it's an opportunity for you to have your picture next to your bed. However, it also has 2 things. You can plug in your phone, your iPad, etc. It stands right next to your bed. You know how many of us have the iPhones or the phones you want to plug in, and you have maybe your lamp. You don't have to go looking, searching for things, but this is the Power Frame. As you can see, I have a picture of my family here, and you could take this anyway. You know, when you go away, you're traveling, you want to be able to say, well, where do I find someone to plug in with to charge my iPad or my phone? Well, it's the Power Frame. There it is, thepowerframe.com. Give them a call. It's very inexpensive. There's a TV special going on, and believe me, I use it. It's very, very handy. I have about 3 of them in my home. My guest, Dr. Thomas Kislan, we're talking about the dry eye. Symptom that hits 20-some million people every year, and you don't have to be in your 50s or 60s, but it also young people. So, Doc, once again, this is very prevalent, all right, and you're looking at what it is. So we have a video now, okay? We're going to show, and Andy, as we're showing the video, you could tell the people what they're looking at. Okay, so here we go.
So, when we look at the front of the eye, what we're going to see here is what happens with the symptoms of dry eye is we get some dryness, but on a microscopic level, looking at the tear film, there's 3 layers: a mucin layer, an aqueous layer, and what's called a lipid layer. The lipid layer is the outside layer. Think of it as an oil slick on water. And if you don't have a good oil layer, the water just evaporates away. So that oil layer is extremely important in preventing evaporation of the tears. And what you see here in a cross section when we blink, we actually get oil that gets secreted You see them actually coming out of the glands there, and those are called meibomian glands, those yellow glands that kind of go up and down on the lids, and it puts a nice layer of oil across the tear film, which prevents evaporation of the tears. So, and every time we blink, this happens. We blink a couple thousand times a day, and every time we blink, we have to have a really good layer of oil there, and if we don't, the moisture just evaporates away. And then what happens is we get inflammation in one of the main lacrimal glands in our eye, which is located where you saw it up there in the corner of the orbit, and we get just a lot of redness that occurs, and you can see the whites of the eye are red, the margins of the lid get red and swollen, and a lot of patients, they look closely in the mirror, they have this condition and just thought, well, I have this and I'm getting older. But it actually, we get inflammation on the bottom of the lids, and when we actually look and we pull the eyelids down, you can see little tiny white spots on the base of the lids there. That's the blocked oil glands. That oil should look like clear motor oil or olive oil. And when I pull those lids down and squeeze on those glands of someone who has this disease, it actually looks like Colgate toothpaste. It's kind of white and all strung together and very hard to get out. And that's a sign of inflammation, and that's a sign of this condition. So one of the things we do in an exam is to make sure that we're always pulling these glands down. I squeeze on every patient on their lids and look for this condition. And here's a picture of actually how many glands. We have about 25 on the top and 25 on the bottom that secrete the oils down. One of the treatments used in the past for this condition was warm compresses. We would tell patients, put a warm rag on their eye, but what would happen, the heat never got to those glands because the heat was absorbed by the skin and the vasculature in the lid. So patients would put these hot compresses on and it never actually got to those glands. The other thing we used to tell patients to do was to massage their eyelids to try to loosen up those oils and get those oils secreting better. And when we would try to do that, didn't really work either. So plus it could cause damage to the eyeball. So what we're looking at and where technology has taken us is what we can do to try to get these glands to secrete better oils, better quality oils, and more oils without causing any damage to the eye and actually do something that works. Well, without showing the device, what really works is actually if we could find a way to squeeze the lids from top down without causing any damage, that actually gets all the bad oils out of the base of the cells. You can actually see the cells there of these glands and squeeze all these bad oils out. So this device we're going to talk about is called LipiFlow. And LipiFlow is an incredible device, and this is an animation of how it goes on the eye. It actually slips up under the top lid, down under the bottom lid. The eye's numb, you don't feel a thing, and the eyeball itself is protected. And now we have this device that slips over the lid and actually squeezes the glands, and we'll show you how this works. But the goal here is to prevent evaporation of our tear film, restore a good lipid layer of our tear film, and get the tear film nice and pristine so we eliminate all of these symptoms that we previously talked about. This device has been in development for many, many years. The doctor who developed it, his name is Dr. Don Korb from Boston, and this has been his lifelong dream, is to really get this technology out to the public, and he's finally done it. He's considered the godfather of this condition. So we're very happy to be really the first ones in this area, and there's only 5 in Pennsylvania, and we're proud to be the 5th in Pennsylvania that actually provide this technology. And it's called LipiFlow. And if patients want to look at it, they can go on the website. It's called lipiflow.com is the website. There's also a website called tearscience.com. And it's a 12-minute in-office treatment. It doesn't hurt. And we're going to show, again, another animation and a video of how this works. But there's what are called activators. And these activators go onto the eye like you saw, and it provides 12 minutes of heat. And what the heat does is it actually loosens the oils in the oil glands, and then the massage from these micro pulsations from these activators evacuates all the bad oils out of the glands and causes these glands to just reset and work like they did 20 years ago. It's an amazing treatment. It's painless. Patients say it feels like an eye spa, and it really can help this condition and help it so it doesn't get worse. Because that's the key, is we don't want this condition to get worse.
So what you're saying to me, I don't know whether I have dry eye, but I may be having some things that my eye is not right. I feel different or whatever. So I come in and you're able to discover that I do have dry eye. At that particular point in time, do you do that treatment on me?
We discuss how severe the condition is and what other treatments may be necessary or helpful. LipiFlow is one piece of the puzzle now. It's one additional treatment we have for patients. There's certain lubricating drops, there's steroid eye drops, there's a drop called Restasis. Omega-3s are fantastic for this condition. And we've actually found that omega-3s, the PRN omega-3, with this treatment together is like a match made in heaven. It's like doing an oil change in your car. If you do an oil change and put all the bad oils back in, it doesn't do anything for your car. We do an oil change here. We need the good pristine oils in there, and the PRN omega-3s help do that. So we kind of talk to the patient, decide what level they're at, and whether they might be a candidate for this. But we're really the only ones in the area that can determine whether or not a patient is a candidate for this, and if they are, we do the treatment right in the office. And like I said, it's 12 minutes. It's painless.
It doesn't hurt?
It doesn't hurt at all.
Because I'm a big baby.
Doesn't hurt.
Doesn't hurt. Well, the interesting thing is that you have this technology here, okay? And I think the biggest fear, like anything, is well, maybe this will go away. I'm putting drops in, you get over the counter without really knowing what it is. But down the road, it could be a really serious problem.
Yeah, and one thing I didn't touch on, but quickly, is that these glands, once they close off and atrophy and die, we can't get them back. So we need to treat this condition before these glands actually die off, or else we can really be in trouble.
Okay, so folks, the number you're going to call, we come back, we're going to show you this opportunity. The number you can call for Dr. Kislan, 453-2020 or 421-3342. One of the fifth, you said there's one of 5 in the state of Pennsylvania?
Right.
Okay, and now you had to be certain qualifications, certifications before you got this unit?
Yeah, and certain training, and really have to have that devotion to treating dry eye disease.
All right, I'm talking to Dr. Thomas Kislan, folks. We'll be back right after this message. So it affects 20-some million people every year, folks. It's called dry eye. It's something to be concerned about. My guest today is Dr. Thomas Kislan. You know him from Eye Care Today. And folks, 24/7, you could watch this show. It's very informative. You have friends anywhere in the country, you could watch it, as well as Dr. Kislan's show, which is called Eye Care Today. But he's here to talk about some new innovation technology that is happening that he has in his office at the Hazleton Eye Specialist, as well as Strasbourg Eye Specialist. Phone number's on the screen. His website's on the screen. I would highly advise you visit it or give him a call, find out about this new procedure. So dry eye, before we show this innovation that you have, what is dry eye again, Tom?
So dry eye is a disease where our body does not make either enough tears or enough good quality tears. And most dry eye patients don't make enough good quality tears. It's called lipid deficient dry eye, and it's caused by a deficiency in how the glands in the eyelids called the meibomian glands work.
Okay.
And that's what this treatment we're talking about, LipiFlow, how it works. It targets keeping these meibomian glands healthy.
But first and foremost, as when you were on the show with Benyo and Befield, Dr. Benyo and Dr. Befield, and we talked about different things, it is very important that you should have an eye exam at least once a year.
Right, at least once a year.
Okay, and omega-3s, which I take, every day, as you know, is another opportunity for people to, no matter what it may be, inflammation, it's important to have. And the PRN brands, which you have in your office, Befield and Benyo have, is important to take, correct?
Yeah, it has to be the correct form. The PRN brand is the triglyceride form. Taking the over-the-counter ones, they got to take 20 a day. They it's not going to work.
And I called you about a week ago about another product that was supposed to be prescribed, etc. And when Dr. Gross called me, he filled me in here again. What we have is really something that's really solid.
Yeah, amazing.
Yeah. All right. So what do we look at right now? Andy, put this up and let Dr. Kislan explain what we're looking at. What is this?
So this is an animation of actually the activators that we showed, actually how it's on the eye. So we have heat that's actually being applied to the glands, and then these activators cause this very gentle pulsation from actually outside inward to evacuate all the bad oils on the lids. And it just very gently gets rid of these oils and the bad oils and causes these glands to reset and work the way they did 20 years ago. So it's an amazing treatment. It's painless. It doesn't hurt. But the key is patients have to find out whether or not they're good candidates for this treatment.
Now, have you actually used this machine?
Oh yeah, we actually started the treatment. I should say the device, because treatments aren't FDA approved. The device was FDA approved about 1.5 years ago. And I'll be honest with you, when it first came out, because again, because of the research we do, I've heard about it and I kind of knew about it. I was a little skeptical. So I took 8 of my worst patients. And one of the first doctors in Pennsylvania to do it is a friend of mine, Dr. Leahy in Allentown. And I sent 8 of my worst patients to Dr. Leahy. And I was floored at how well these patients did when they came back. I was absolutely floored. And it's at that point that I made the decision that I have to be able to provide this technology to the patients in the Hazleton and Stroudsburg areas and all of Northeast Pennsylvania if they so choose. So in end of February is when we actually got the technology into the office and started doing the treatment. So we've done many, many treatments since then.
So you're pleased with it?
Yeah, in fact, I'm going to have, for those who don't know, I have severe dry eye myself. Take the omega-3s, take Restasis, everything. I'm probably going to have it done either next week or the week after once I can just find some time to do it. But I'm amazed at the results we get. And it's not an immediate, it's not the patients are done and they go home and say, wow, my eyes feel great. This condition didn't happen overnight. It slowly develops and gets worse, so it's not going to get better overnight. There's a lot of follow-up we need to do and just kind of watch things, and we talk to patients through this. But over time, we see improvement in their symptoms, improvement in their vision, and hopefully we can even get them off some of the medicines they're already taking.
Now, do you do both eyes at the same time?
Usually, yes. 99% of the time, because both eyes are usually affected
So there's
equally.
no discomfort? I mean, even though it's just like...
Patients, basically, most of them say it feels like they're having an eye spa. It's warmth and it's massage. So it's really, very comfortable.
But here again, it's something that really you should address, particularly if you're having any kind of symptoms. What are some of the symptoms again that you get?
Dry, scratchy, red, irritated, and sometimes watery eyes. Patients say their vision fluctuates a lot. They'll be on the computer at work and say, I got to blink a couple times to clear things up, and my vision comes and goes. And a lot of times patients come in and say, I think I need new glasses, but it's not a glasses problem. It's a health of the eye problem. And that's where it's very important to distinguish, because I've seen multiple patients who end up getting a pair of glasses from another doctor. They really shouldn't have had another pair of glasses.
Getting back to an interesting thing is, when I came to you, I had this surgery done, the LASIK surgery Dr. Bucci did, and I just wanted a routine checkup. But I haven't seen you. I figured, let me just go and get my eyes checked, etc. I wasn't really having any kind of concern, just a routine. But when you checked me, you found that there's a little concern there with the pressure of the eye. Nothing ultra serious, thank God, but something that had to be addressed before. If I would have waited a couple more years, then it could have been a little serious problem. So here I am, not even knowing that, coming to you for a routine checkup, and you find certain things that at least we're addressing right now. And that's why I wanted to have you 3 guys on the show and have you on the show today, Tom, is to give people an education. Folks, you're looking at, I'm telling you, I'm the biggest baby to go to any doctor, but thank God I did. And Kislan was able to, Dr. Kislan was able to, correct what I'm having, and I go every 4 months to get checked. But this dry eye thing, there's no reason for it.
Yeah, and before we close up, I think one point I'd like to make is LipiFlow. This might be one of the biggest technologies, one of the biggest treatments to come to eye care since the injections we do now for macular degeneration. This, I think, is going to change the way we treat these patients, and a lot of patients can benefit from this. So to have this technology in our area is really a big deal.
Well, congratulations to you, Tom. It doesn't surprise me. You're always ahead of the curve, and that's great. And your show is doing great, very informative, really. A lot of people appreciate the show, and thanks for, having the show with us, okay? Folks, you can watch this show anytime, ssptv.com. Watch the Sam Lesante Show. This show, tell your friends. The number from him to call is 453-2020. And in Strasbourg, it's 421-3342. We'll see you next time on the Sam Lesante Show.